It's 3 o'clock. So, good afternoon. This is Dr. Munjal Thakar, and yesterday being the World Autism Day, we felt that it is time that we share our experience for now almost more than a decade about treating autism. The challenge for any physician who wants to work with autism lies in understanding this disease, the neurodevelopmental problems, and to interpret what these symptoms really mean to a clinician. That is the first challenge. The other challenge that especially a homeopathic physician faces is to how can these disease symptoms or the suffering of the autistic child get translated or interpreted on the homeopathic perspective. These two challenges need to be effectively navigated before anything impactful can be done for homeopathy. For autism. And these interpretations, uh, these perspectives are not very easily found in textbooks of neurology or psychiatry. So, keeping this in mind, I thought it interesting as well as important to share with my homeopathic colleagues and my students as to how one can navigate through this uh, difficulties. So while we do the talk, most welcome as usual all of you to put in your questions, and I would be happy to answer it. So the first question is, what does this word autism mean? And how did this word come into being? Because if we understand this terminology, we will be able to understand quite a bit about this disease. So, very early on, before the 1960s, where child psychiatry was not a very well defined branch of medicine. Very little was understood, or it was understood rather in a vague manner. The word autism was used predominantly by psychologists. So, the word autism means the inner world, the unconscious world, which is usually in the form what we encounter in daily lives in dreams, which is very symbolic. So, normal, healthy infants were thought to live in this kind of fantasy world or hallucination world. So, in fact, it is a breakdown of one's ego defense in schizophrenia when one goes inside this inner world into the unconscious, and then the kind of unconscious just explodes out. So you will find that one of the ego defenses is autistic fantasy. If you open the textbooks, you will find autistic fantasy as an ego defense mechanism. In fact, it is one of the times where the ego defenses have broken down, and they are the most primitive kind of ego defenses. So, till the 1950s, 1960s, this word autism was used to describe this state where you are in the dream world. Like how a schizophrenic would be, how a psychotic patient would be, and how infants would be. But as child psychiatry grew, the connotations, the implication, and the usage of this word changed completely. And as the care for the mentally ill began to change, there was a pressure on the medical field to understand it better, to deliver better health care. So, this should be around the 1960s. Prior to that, there were mental asylums in which children or even anybody who is mentally sick, mentally ill, were to be kept in, and they were given institutional cares in whatever crude manner that was possible. But as the science grew, the need for these asylums was no more required. And so the mentally challenged children were with the parents. And now the parents demanded of the medical field to understand the disease better and to deliver better care. And then on, autism became a word as well as a disease condition where the child does not actually have any kind of fantasy or hallucinations. So we need to understand this a little bit. So I have been asked this question: what are the causes, genetic acquired causes, mobile phone radiation, vaccines causing autism? So these uh, questions can be easily looked through any textbooks, and reasonably good answers can be found. I will try and answer it a little later. But my aim is to bring out a different dimension of autism for my homeopathic colleagues, which is not easily available in the textbooks, as I said right in the beginning. So, as I said, that autism, being in an autistic state, is now equated to an unborn child. What do I mean by this, and what really are the clinical implications? So, all the mental diseases, all the mental illnesses are well described in a book called DSM, Diagnostic and Statistical Manual of Psychiatric Illnesses, and another book, it is called ICD-10. So autism, till few years back when I began to learn about autism, was called pervasive developmental disorder, or in short they would call it PDD, pervasive developmental disorder. What is the meaning of the word pervasive, and what is the meaning of the word developmental disorder? The word pervasive means it is across the brain. It is not localized to any single part. The defects are several, manifold in different parts of the brain. So it's a very diffuse problem. Also, this problem has pathological changes at microscopic levels, and hence they are not very easily documented in the usual MRI. So, coming to this concept of unborn child, we need to understand what are the core problems with autism. If I were to group broadly, we will find that there are problems in social communication deficits. Social communication deficit, three words to understand. This is one group of symptoms. And the other group of symptoms is restrictive interests and repetitive behavior. So these are two broad groups, and let us examine one at a time. So if we look at the first group called social communication deficit. So if we look at the development of the infant, we normally understand development in terms of milestones, which we are talking about motor milestones, where the motor system is developing. So that is one aspect of the total developmental phenomena. The other aspect is the development of the intellect or the cognition. The third aspect is the development of communication speech, and social interaction. The third aspect of development, which is the social development, social adapting to one's environment and interacting with one's own environment, is extremely critical. Because if this doesn't happen, then the survival becomes a problem. The development of the speech is deeply interconnected with the development of the intellect. So, if we look at how one communicates, one is the verbal communication. The more developed verbal communication is speech and language. And then the other way of communication is the non-verbal communication. So children who do not have sufficiently developed intellect and sufficiently developed language can still communicate with the environment, with the caregivers, with the people around through non-verbal means, gestures, bodies, expressions on the face, and through rudimentary vocalization also. So you will find, and of course, the social growth involves connecting with people, developing relationships. So if we look at the whole social development axis of development, so we spoke of motor, we spoke of the intellect, here we are speaking of the social skills and social development. Of this, one part is speech and language, the other is non-verbal communication, and third is creating bonds, creating a relationship with people around. And in autism, one of the core defect is along the social axis, where there is a severe deficit or a severe defect in communication, number one. So communication is always a two-way thing. If you wave at me, I wave at you, there is a reciprocation. So in autistic children, this ability to reciprocate, this ability to respond to an environmental input is a problem. So therefore, one of the core features of autism is social deficit. Communication deficits. And then the other group, as I said, restrictive interests and repetitive behavior. So you will find that these children will have habits to do some repetitive action like flapping, like jumping, or making some kind of sound all the time, or especially more when they are very excited. Also, these children, because of this very repetitive and restricted interests, they cannot tolerate a change in the surroundings. Therefore, they will insist that everything has to be same. So children, you will find very often they can be very, very finicky, with cleanliness. Many children are extremely finicky about their schedule. Exactly this should happen. Neeraj, Neeraj bhai, I request you to switch off your video. Yes. Yes, Dr. Digma, I'll come back to your question a little later. So they are very finicky, rigid about certain things that are around in the environment. And they want it that way. And then comes an extremely important aspect is these repetitive and restrictive behaviors also arise from a problem in the development of the sensory nervous system. We spoke of the motor axis, motor nervous system, then the intellect, then the social development, and then this is the fourth aspect of development, which is very critical, is that of the sensory nervous system. The sensory nervous system develops in utero. Imagine if your sensory nervous system did not develop in utero, what will happen? Just imagine if you did not know, did not perceive touch, if you did not perceive pain, and you are born, the baby wouldn't cry because at birth the baby has experienced the uterine contractions and then out into the world all along its surface. The sensory system is an extremely critical part of survival. And this is the space where a lot of neurodevelopmental problems, not just autism, have a very serious problem or deficit in the sensory nervous system development. So, what is the problem? The problem is, so what are the five senses that we know? Touch, hmm, sound, ear, eyes, taste, and smell. These are the five senses that we are aware of. There are two more senses that one will have to be very, very aware of, and that is the vestibule in your ear, inner ear, is extremely critical to your existence. But we don't speak about it. The vestibule, the vestibulocochlear nerve, the eighth cranial nerve, connects the vestibule into the brain. The inner ear, you remember, and those three semicircular canals and those otoliths floating. These are sensing gravity. Now, getting the sense of gravity is extremely crucial. Imagine yourself in a space of zero gravity. What happens? The first and foremost reaction would be panic. In fact, those astronauts that go into space into zero gravity are trained to handle this zero gravity. That means their vestibules are trained how to handle it. Your orientation of how you stand, how you lie down, how you sit, at what angle you sit, at what angle you turn your hand, this vestibule is conveying to your brain. And in autism, often you will find that this sensation of the vestibular sensation can be compromised. So, what are the implications of this? So, the child doesn't experience the correct assessment of the gravitational force. Therefore, you will find that these children in autism will not want to sit and get potty trained. They don't want to sit on the pot. Now you can understand why this is the issue. Because they cannot face the gravity. They don't know how to handle the gravity. It is like a black hole for them, falling into it. It is like falling steeply from 10 floors down. You will find a lot of these children have either no tolerance to any kind of downward motion or upward motion, because both need assessment of the gravity. And the need or aversion, both, either way it can be, to keep swinging, rocking. So either some of these children will not want to sit on the swing at all, or they don't want to leave the swing all the time. They need this rocking motion. Because the problem is in the vestibular sensory apparatus and perception of that. So this is one addition in term, more than 5, there is one more. And that is the proprioception. For those who remember your first year physiology, there was this chapter in the musculoskeletal system called muscle spindle and proprioceptors. The proprioceptors give us the position of where the joints are. The muscle spindle gives us how much tension in the muscle is required to keep that position of the joint. So very often this apparatus, the data coming from this apparatus gets compromised. And therefore, you will find that these children will sometimes press very hard on the paper to write because they don't know how much pressure they are putting on the paper, or they will write too lightly. So there's a whole gamut of behavior that starts emerging because your sensory system is at a fault. And depending on which sensory system is a problem, clinically you will see the symptoms accordingly. So the challenge here is, from what is clinically available, you should be able to find out what is the real problem. For example, if you will find many of these children saying they can pass stools only if they are standing and they will not want to sit. From a homeopathic standpoint, one would feel that this is so characteristic symptom. But the actual symptom is what? Fear of falling. Because he fears that he will fall into that pit. It is not stool better passing or in standing position. You will have to see through the symptom, where it is coming from. And to understand this, you will have to study the textbooks, study the patients, and in addition to that, study in detail the notes of the occupational therapist assessment. So very often, I will ask my patients to get a very detailed assessment and reporting by a good, diligent occupational therapist. So one will have to have the ability to see through what is just merely obvious in the clinic in autistic cases, and also communicate and learn from the occupational therapist, from the psychologist, what inputs they are giving and what they are writing. Very often we cannot understand the complex terminology of the occupational therapist and psychologist both. So the idea is pick up the phone, call up the occupational therapist, ask him or her, please explain what is the meaning of this. And if you are seriously committed to treat autism, do not hesitate to do this. Don't even Google it. Because someone who deals with this clinically day in and day out will more easily explain to you. And you will be able to grasp it better, and it will help you to grasp in terms of the homeopathic interpretation, homeopathic perspective of the symptom. And then so I already spoke about these two or three very important core symptoms of autism. So now, once this is understood in a very broad and in a very, very oversimplified manner, we need to understand that all these defects, whether in the social development or in the sensory system and in the intellect and in the communication system, there is a direct impact on one's psyche. Oversimplify it. If your motor system, that means the muscles or the neuromuscular system, fails to develop properly, the perception of the individual about himself, because muscles and the neuromuscular system gives a sense of self. Are you able to understand? If you have good muscles, good skeleton, you have a proper solid sense of who you are. This is the first and the foremost impact. So children who are well built and strong have a good sense of self-worth as to who I am. As opposed to this, children who are very lean and their muscle mass is not developed, they will also not be able to perform physical activities like other kids. And this has direct implication on the self-worth of the child. And the development of the sense of self. And children who have too much hyperactivity and attention deficit, which a lot of children with autism will have, will have a problem with attention to what is read, to what is spoken, to what is heard, what is observed. So, moment you don't have proper attention at the visual level or at the auditory level, then your ability to understand is compromised. If your ability to understand is compromised, then your ability to do a particular task is compromised, which in turn will reduce and hamper your overall performance, which in turn will have a hit on the self esteem of the child. So you can see what is the connection. There is a problem with the visual system, there is a problem with attention, there is a problem with learning and comprehension, there is a problem with doing a particular activity, there is a problem with output, and then there is a problem with self worth, which in turn creates behavioral issues because that child has to face the society. So these children may become very aggressive. This in turn forces people around him or her to behave with aggression or to isolate the child. Where is the actual problem? The visual deficit. Problem goes where? To the final behavior of the child being aggressive and hyperactive and attention deficit. So the challenge is, can you see the visual problem in this aggressive child? Similarly, you will also find auditory issues, hearing. Too much sensitive to sound, too little sensitive to sound, and processing that information coming at the auditory level. So these are the challenges that a physician faces in general if he or she has to encounter and engage with autistic children. And for a homeopath, you have one step higher challenge. And my experience of last all more than a decade with autistic children is early intervention is the key. The earlier you pick up autism and the earlier you start homeopathic treatment, regardless of whatever is the intensity or the degree of autism, mild, moderate, or severe, the outcome is going to be better if you start at the earlier. Here, but the obstacle is that the parents and the family very often are in denial of accepting the diagnosis itself, and therefore the resistant to do any treatment for that condition. The second part that experience has shown, children of in autism spectrum which show clear behavioral symptoms are better treated, better outcome, than children who don't have too many behavioral problems. But they have other issues. And we have ample proof, ample documentation that autistic symptoms can be reversed, especially if the child is mild to moderate degree of autism. And a lot of these children, provided early intervention is given, can go back to mainstream school and learn with mainstream children. And in cases of severe autism, we have found that they also respond well over a period of time, provided a regular occupational therapy, applied behavioral analysis, and speech therapy is instituted, remedial education is instituted to these children. And this is true for even mild and moderate autism also. Often in severe autism, we have found that children do not receive, because of the severity of their problem, they are not able to receive the therapy. And with introduction to homeopathic medication, they start becoming amenable to therapy and reach to the next level. In severe autism, many times we find that after patients come to us, after giving several years of therapy is given, some degree of improvement is arrived at, and then there is a stagnation at a certain level. But introduction of homeopathy, we are able to take further next step of improvement. So an integrated care is the approach of choice, with homeopathy as the mainstay of treatment. Then comes a situation where there was a question somebody asked that has been asked: genetic and acquired causes of autism, what is called as secondary autism, where autism is a small part of a much larger disease, like an inborn error of metabolism, certain enzymes which are critical for survival are deficit or partially functioning. These children will have many neurological issues, and part of that will be autism. These cases are certainly very complicated to be treated, and they are fortunately rare too. In these cases, we are able to help the children to alleviate their suffering. Mobile phones, vaccines, there's a lot of back and forth literature on vaccines and mobile phone causing autism. There is no clear, solid evidence, but nevertheless, we have seen parents will come and tell you the history that after a particular vaccine, my child has stopped communicating my child has stopped making eye contact. The eye contact is the first interaction, non-verbal interaction with your environment. So you find at 2 months, the child will look at you and smile. This is the first milestone of social development. And often in children, if you ask the parents properly, they will tell you that this child never smiled at us or looked at us. Most often, parents will come and tell you, this child does not respond when we call out his name. He remains in his own world. This is the classic presentation of autism. And there is one more question. Dr. Digma had asked me, children are moody. Dr. Digma, the most core feature of autism, social communication deficit, regardless of whatever is the age of the child is communicating with the caregivers, either through making eye contact, through making gestures, through smiling. If this is compromised and the moods are changing, then one has to be suspicious of autism. But if they are intact and the child is moody, then the outlook is completely different. So I think I have shared in a small nutshell what experiences and difficulties that a homeopath faces in treating autism. And also I have shared what we can do for autism. Any other questions, most welcome. I will take another 5 minutes. If there are more questions, we can answer it. Or any one of you can even share your experience in treating these children, because lots and lots of children now directly come to homeopaths to get their children with autism treated. I also find that the parental resistance to diagnosis is also getting better, less, as this disease is now known that such a disease exists. So earlier, when we started, we would find that parents not willing to accept. I'm sure that is still existing, but I believe, I do not know if that is other people's experiences also, that the initial resistance of not accepting that my child has a problem is much less. So at least the first difficulty is a little less. Okay, any other questions? Some thoughts? Also, welcome to give a feedback on this or to share what you have learned during this. Also, towards the end of this session, I would like to share with all of you that in the last week of April and first week of May, we are coming up with season 2 of diabetes and homeopathy with all new cases. We will be revising and consolidating all the concepts of diabetes what was done in season 1, and we will soon pass on the information, detailed information on that. So keep watching this space both on Instagram and on YouTube for more information on this. Okay. So is it better? Are you able to hear me? Okay. Okay, so fine, fine. Thank you. Dr. Farheen, are you able to hear me? Thank you, Dr. Ujwala. Okay, so we call it a day for today. Thank you, Dr. Sadhna. I hope this helps you treat your patients better. Any questions further? Any suggestions for further future talks that we are doing? Every month, practically, I do one live coming up with some interesting topic. So, if you have suggestions on the topic, please share it. You can share it now, you can put it in the comments later. You can also put it up directly, you can message me. If you have some topics that you want to take up, and provided I know that topic well enough. Okay. Neuropsychiatry and homeopathy. Dr. Keyur, this is a PhD level topic. I am also trying to grasp it because I am just beginning to get a glimpse of neuropsychiatry. So, when this Pandora's box is open, let me tell you that what was considered psychiatry, pure psychiatry, many years back, is now beginning to understand to be not just neuropsychiatry, but immunoneuropsychiatry. So the yeah, thank you very much for your praise. Okay, Dr. Sadhna, something like that can be done. I would enjoy it. Yes, so I was just saying that from psychiatry it has become neuropsychiatry, and now it has become neuroimmunopsychiatry. What exactly Hahnemann told us that the strict division between mind and body is actually blurring, and we are coming to a new domain where it is complete mind body is just one. Okay. So, Dr. Sadhna, you can just send me a message and we can do something about it. I would be very happy to uh, give my inputs in such cases. It would be very interesting and very helpful. Okay, guys, so take care. We will have to close for today. And I see you back again. End of April, diabetes session. And next month, we'll come back with some more live sessions. Okay. So bye bye and take care.